Hello everyone, welcome to this Ask Me Anything. This is an important topic, and it's one that's come up a few times from members in recent weeks, and it's about how to differentiate different types of chest pain or chest discomfort. Now, clearly as a cardiologist, the one I'm most interested in is pain coming from the coronary arteries, or ischemic pain. And typically cardiologists, when we see patients in clinic, will define symptoms as either typical or atypical, meaning not typical. So what do we mean by typical pain? Well, there have been a whole variety of different sort of specific definitions over the years, but the one that tends to be used most commonly is something called the Rose criteria, and these were developed in the early 60s. Essentially, they revolve around a few different aspects of the pain. So typically we're talking about pain on the left-hand side of the chest, often at the sternum and maybe to the left arm and jaw. It's typically exertional, so it gets worse if you try and do something. And the reason for that is that the heart arteries, under conditions of stress, are having a harder job delivering enough oxygen to the heart muscle, and therefore people get the cramping sensation of angina. And so a pain that, for example, occurs with walking or brisk walking, particularly, for example, up a hill, would be typical for that. But then also importantly that it goes when under resting conditions. So if you walk up a hill, you get pain, you stop and the pain resolves, and that would be a typical history. Or indeed if it resolves with GTN, so a nitrate spray under the tongue. So that would be a sort of a typical description of symptoms, whereas atypical symptoms obviously can be quite varied and maybe anything other than that, but for example might include a very well localized pain. If you can put one finger on it, then that's less likely to be coming from the heart. Pain that's worse in different positions, so in different body positions. For example, lying flat. It's not to say it's not a heart pain, but not an anginal pain. Pain that's worse on a deep breath in. Again, that would be considered atypical. Pain that's worse with eating, also not typical of coronary artery pain. The tricky thing is, of course, there are other non-coronary causes of chest pain. So, of course, the heart arteries are the main ones we worry about, but things like inflammation of the heart, of either the heart muscle itself, we call this myocarditis, or inflammation of the lining of the heart, so-called pericarditis. Both of those are heart causes of chest pain, but are not necessarily related to the heart arteries. The commonest sort of, differential diagnosis might be gastrointestinal cause, so problems with, gastroesophageal reflux, for example, or indigestion type pains are very commonly can sound similar at first, the first point of asking. So I think it is difficult. There are some more typical features. And of course, the message as always is if you've got chest pain and you're worried about it, then do seek proper medical opinion. It is interesting as well that if you look at some of the trial data, then when researchers used the definition of typical pain, so Rose typical pain, then you're more likely to get a response from your intervention, be that, for example, stents, let's say, for example. And I guess that makes sense because patients who report non-typical pain are less likely to get relief of their symptoms when they have their coronary arteries treated. So I hope that helps, and of course, do remember the advice that if you are getting pain, just get it checked out. But hopefully that's been of use to you. Thank you.